So for an upper back and shoulder massage, I like to do a good bit of dry work to warm up. I'm just going to use the outer edges of my hands to trace these shoulder bones, landing on those upper traps, and just getting a sense for how things feel from right to left, and just in general. If you're someone that's wanting to learn about trigger points and really working through adhesions, this is like a gold mine. You're going to find a lot of trigger points in here. And because we are going to be working on the infraspinatus today, I'm just going to land on top of these scapulas with a soft fist and working the soft tissue a little bit and just giving Nicole kind of a blueprint for what we're going to be doing today. Kind of in the perfect position to do a pincer grasp. And it's a really nice way to segue into some more focused, deeper kind of work. Just being sure to put pressure along that muscle belly and not on the skin itself. This can honestly feel kind of aggravating to your client. So, just not overdoing it either. Just getting some fresh blood here. And I'm going to go ahead and grab my oil. Even for a upper back and shoulder focus massage, I like to include at least some effleurage strokes for the entire back. I think it just feels better and creates more balance. I like to do some pretty slow effleurage strokes. Grabbing onto those lats on the way up. I find this effleurage stroke along the spine with soft fists is just more effective and also easier for me as we get into the massage a little bit more. And being intentional about how much oil I'm putting where, keeping the upper back oiled to a place where I can still do deeper work and not feel too slippery. I also don't want to end the massage and feel like my client has a pool of oil on their low back that was never used. And I'm just going to work on this neck a little bit, the levator scapula a little bit. So when people think of upper back massage, they, think of the obvious, but it's really important to include the neck in this kind of work, especially when it comes to the upper trap, given that it narrows into the neck and gets really tight in there as well. This is a pretty gentle way that you can work the tops of the shoulders as well. It can be as gentle or as firm as you need it to be. Focusing on these rhomboids as well. Picking up as much oil as I can with my forearms. And at the same time, just giving these lats a little bit of love. I'm going to land on these rhomboids with my elbows. And this is my favorite way to start to transition to one side. When I'm doing upper back work. This usually feels really nice. You do need to be careful when you're using this technique on someone that has scoliosis or any curvature along the spine, obviously. And I'm going to go ahead and walk my way to the side of the table. I'm just going to start narrowing in on this trap area, mostly the upper trap. Letting myself relax into deeper work by using a broader surface area, a good part of my forearm, and also just allowing Nicole to really get used to deeper work with a tool that's a little bit bigger. It's more tolerable. When in doubt, just trace this shoulder bone. You're going to find adhesions in pretty much 100% of people here of some kind. And as you start to get clearer about where the adhesions are on your client, you can start to just slow down and start to use a little less surface area. So a little bit more of your elbow, a little less of your forearm. If you're working on someone who is just so wound up and so tight, you might want to just stick with a broader surface area for a little bit. Because you want to feel a stretching and a release in the muscle fiber. You don't want it to feel like it's just being poked and prodded. And with that deeper work, I like to just give my client and myself a little break. I like to work on the lats as a little breather, also as a little preface to doing the work on the rotator cuff muscles as well. Usually revisit this upper trap at least once more. I might start to do more static holds at this point. And just really pay attention to how your client is responding to that deeper work. And I'm going to start focusing on this infraspinatus. I'm going to move the arm so it's a little easier to work on. Also working on the teres minor and major. And really just warming everything up to start. Sometimes I'll work on this teres minor and major first. More often than not, I will work on that infraspinatus. Spend most of my time there. I would say that this muscle can wear your thumb out quicker than any other muscle. It's very thick and fibrous. So you can also use your elbow and just really pay attention to how your body is feeling as you're working. And before I really ever do deep tissue in the infraspinatus, I am sure that the muscle needs it, and I'm sure about working on the right spot, just for the sake of my thumb and all of it. This can take a great deal of pressure off of the shoulder if you get some really good releases in here. It can lead to a much more open, better feeling in the body. And as I kind of wrap things up, I like to just do a broad stroke, including these rotator cuff muscles with the traps. And just really reminding all these muscles how they can work together harmoniously. And to finish, no matter what area of the body I'm working on, I like to do something for both sides. And I'm going to do a few long, relaxed effleurage strokes for the whole back. Crossing over that iliac crest can feel really nice. And it's okay if things don't feel quite as flowy, if your oil has absorbed. And just nice and slow. And I like to just make nice these rotator cuff muscles on my way up. And taking my hands off nice and slow. That is all for today.